Introducing the redesign of the bill. It should essentially be related to the status of the patient, interconnected online, with their legal status as Social Security, the tax system, health system, and/or companies or sponsors, insurance coverage and health providers. When the patient makes his way to hospital or doctor, shows the admission staff estimate your budget, your guarantee letter, and proceeds to cancel the share by the difference not covered by insurance. Staff proceeds to enter data support insurance payment on your computer system, and the data feeds the patient's already stored, where initial patient data such as name, national ID is recorded, if applicable, your identification of the tax system and identification of national insurance, residence, address, name of insurance sponsor of its coverage and its legal address, amount of the initial budget, the amount of the initial coverage, and the initial payment of the patient for the difference not covered. Currently, the bill in most hospitals nationwide not reflected in the bill some initial data as the concept of initial budget, initial coverage, and down payment patient. Neither the details of your tax identification or the Social Security. From this moment begins the redesign of the bill to the project presented in this competition to reach the final bill, which reflects the final coverage by insurance, of the medical procedure that the patient is to be performed at the time of the initial budget request. Then, once collected all charges on the bill, we proceed to verify the payment part that corresponds to the insurance, considering the amount accepted by insurance, the adjustments that insurance does not recognize, and coverage to pay for the insurance plan the insured. Subsequently, it is verified and the corresponding patient where your deductible, your co-pay, your co-insurance and other amounts not covered by insurance includes part is posted. Finally, the computer system automatically calculates the outstanding debt by the patient, if applicable. In both cases mentioned above, if the bill charges are lower than budgeted, settlement by the insurance is automatic, no advance notice is required. If on the contrary, the bill charges are higher than budgeted, if necessary contact the insurance and then with the patient. For this process is immediately reflected on the invoice. The invoice will not be printed, it is sent to the insurance company a tentative model medical bill by fax or online. Then the provider of medical services receive information related to the definitive coverage by insurance and proceeds to enter the main patient account. After verifying the information entered, the employee proceeds to generate the final bill, which is sent to the insurance company, after the signing of the patient, either in digital format or in writing.